If you're still feeling symptoms weeks or even months after recovering from COVID-19, we have some important news to share. A new review published in JAMA Network Open Medical Journal shows almost 3/4 of moderate to serious COVID cases result in long-term symptoms. Joining me now is ABC-7 at 4 medical contributor Dr. Neha Sharma. She's medical director of the hospitals of Providence, Northeast, and Horizon City. Dr. Sharma, most people with COVID-19 get better within weeks of illness, but some people experience post-COVID conditions. What are those?
These are a wide range of new, returning, or ongoing health problems that people experience more than 4 weeks after first being infected with the virus. And what's interesting is that people who did not even have symptoms when they got infected can also get post-COVID conditions.
So what are some of the symptoms that they need to watch out for?
There are two conditions that are currently being studied. One is long COVID-19, and the other is the multi-organ effects of COVID-19. For long COVID, the symptoms include fatigue, shortness of breath, dizziness, and difficulty concentrating, what they call brain fog. And again, these symptoms can last for weeks or months, or sometimes appear weeks after the infection is gone. Multi-organ effects can be most, if not all, organs in the body, and including lungs, the heart, the kidney, and the brain. And they can also manifest as autoimmune conditions or clotting disorders. And some other symptoms to really look out for, since May, I have to mention, May is Mental Health Awareness Month, and the trauma of this virus, after the patients recover, they are at higher risk of PTSD, depression, and anxiety.
All right, so who is at risk of getting these post-COVID conditions?
Anyone can get it. Whoever got infected is at risk of getting post-COVID conditions, even if they were asymptomatic when they got infected. But who is at higher risk, we still don't know. But a lot of studies are underway to better understand these conditions.
So is there treatment available?
Yes, there are definitely management options for this condition. And what's reassuring is most people do recover with time. So if you think you're suffering from a post-COVID condition, please talk to your healthcare provider and come up with a treatment plan.
ABC-7 at 4 medical contributor Dr. Neha Sharma, thank you so much for coming on this afternoon.
Thank you, Mark.